Hey, I'm Dr. Hector Chapa. I'm actually at St. Joe's Labor and Delivery, which is very fitting because you guys are about to enter a very similar scenario, which is labor and delivery for your interprofessional OB simulation. It's going to be a lot of fun, but I have to be honest, it's also a little stressful, but that's what you signed up for, right? I mean, part of nursing and medicine is to be in conditions, in situations that make us uncomfortable. I mean, they take us out of our comfort zone, like these two emergencies that y'all are about to do. So y'all are going to cover postpartum hemorrhage and eclampsia. So if you didn't know what the scenarios were, you do now. And so this video is very brief. It's just a quick recap. It's a reminder, because you all should have learned this already, and I know you have, both from the nursing and medical side, as to what to do to manage these very difficult and scary conditions. Both of these can rob women of their lives. So very quickly, here's a quick recap of management for those two. For postpartum hemorrhage, remember that ACOG has redefined what that is. It used to be 500 milliliters of blood loss after vaginal birth and 1,000 for C-section. That is no longer true. ACOG has now redefined that and is universally accepted that postpartum hemorrhage is now 1,000 milliliters of blood loss, regardless of mode of delivery, including the first 24 hours. So remember, for postpartum hemorrhage, look for the 4 T's: tone, tissue, trauma, and then thrombin, which ironically is the lack of thrombin, just like it's the lack of tone that can cause that condition. After you do your survey for the 4 T's, then you have to begin your interventions very quickly. There's 3 boxes of intervention. You need to put these to work quickly to prevent her from exsanguinating. The first is physical interventions. Rub the fundus. For the medical student who functions as a physician, puts a hand inside the vagina and compresses the lower uterine segment, which usually becomes boggy and can bleed. The third physical intervention from uterine fundus massage, bimanual compression, then follows in and out catheterization. So remember, those are your physical interventions to try to relieve the problem. And it works in majority of cases, but not all. Remember that the full bladder prevents the uterus from contracting, so emptying the bladder is key. The second box is pharmacological. Very quickly, everybody gets Pitocin, that's standard, but remember your other medications like Cytotec, Methergin, and Hemabate. I'm not going to give you those dosages because that's for the medical student, the physician, to remember. So for our nursing side, if your physician in the simulation says, oh my gosh, I need Methergin, you need to correct them and say, wait a minute, doctor, I need a dose and a route and frequency. So hold them to that because that's their job. Not only should they know the medication, but they need to know the dose, the route, and the frequency for which it can be repeated, if at all. So hold them to that. Also remember that there's some contraindications to some medications. Some women cannot get Hemabate, and some women cannot get Methergin. So I hope you remember who's who. The third category of intervention for PPH is very simple, and that's procedural. If physical methods and pharmacological don't work, you've got to do something, whether that's placing a Bakary balloon that allows for tamponade to try to stem the bleeding from the inside of the uterus with a little balloon, or surgical management. You have to make that decision to prevent her from spiraling down. Now let's change gears quickly and we'll wrap this up about eclampsia. Remember that high blood pressure plus seizures is eclampsia to proven otherwise, and it can be deadly. Remember that the medicine to go to first-line care is magnesium sulfate, not to stop that eclamptic seizure, but to prevent other ones from occurring. Remember that mag sulfate is not an anti-epileptic medication. So if she keeps seizing, you have to ask yourself, why is that the case? Remember your situational awareness. You may have to get a level of magnesium to see if that's therapeutic. Does she need other medications to try to stop the seizure? And above all, don't forget to work as a team. Because whether it's postpartum hemorrhage or eclampsia, if you're doing things individually and not communicating one towards another, you lose, but more importantly, the patient loses. So have fun today. It's a lot of fun. It's a little stressful, but that's what labor and delivery is. So we'll see you next time on another simulation.